accept. Don't punish me with brutality. Come on, talk to me so you can see what's going on. Yeah, what's going on? Tell me what's going on. I'll tell you what's going on. Woo. Right on.
Well, welcome to the Did You Know Show. My name is Brian Green, and today's show is sponsored by Always Best Care Senior Services. We provide in-home care primarily to seniors, but if you're somebody that has had a hip or knee replacement, a back injury, if you're recovering from a stroke or battling cancer, if you're battling COVID, please think about Always Best Care first. We're the agency that never sleeps. You can reach us right now at 267-909-9248 or visit teamgreenabc.com. I want to remind our listeners that we are looking for a clinical manager for our skilled care division, and we have open RN and LPN positions for both full and part-time per diem positions. And we are looking for some customer service reps. If you're an experienced customer service rep and you're not scared of talking to people, particularly seniors, working through issues, and a busy call center, certainly give us a call at 267-909-9248. We have positions on the first, second, and third shift. Okay. I want to just give a shout out to my friends at McGee Rehab. I'm on the foundation board there, which is a part of Jefferson, and they're going to be having their Night of Champions virtually on this May the 13th, which is Wednesday, and we are so excited. And I usually am the MC for the event. I apologize. That's going to be on Thursday, May 13th, 7 p.m. So McGee provides an array of programs for patients during their hospital stay and after they return back to the community. These programs are vital to healing and have continued throughout the COVID-19 pandemic. The funds that we raise at the Night of Champions makes possible for these patient and community programs, including art therapy, pastoral care, horticultural, music, patient activity fund, peer mentors, recreational therapy, Think First Injury Prevention Program, the Facility Dog Program, wheelchair sports, which includes basketball, racing, rugby, sled hockey, and tennis. These programs and many others at McGee rely upon charitable support, and by supporting the Night of Champions, you will help improve the quality of life for all McGee patients and individuals with disabilities in the community. I've been on their board now for 5 going on 6 years, and I have so much fun at the different events. And this is one of the events I look forward to. They normally have it down in South Philadelphia at the Sheet Metals Worker Union on Columbus Boulevard. Anyway, in the past, I've been one of the MCs and just have fun with the auction. You know, you don't sneeze when I have the auction, Mike, because I will say that you bought something. But shout out to my friends at McGee Night of Champions. If you're so interested, certainly look up McGee. You can look at McGee Rehab or giving@McGeeRehab.org, or you can call my good friend Zach Ernst, who works in developmental programs, and his number is 215-587-3090. I want to say Happy Mother's Day to all of the mothers out there, the aunties, the Medeas, the chubbies, the grandmothers, the grandmas, the moms, the nan-nans, the grandmoms, the glam moms. You know, you ladies and grandmoms these days. I was blessed. When my mother started young, I had both my grandmothers and for a very long time my great grandmothers. And Mom, I hope you have a really good day tomorrow. I don't really have anything planned other than just featuring, what you guys want to do. So I want to also give a shout out again to the Boys and Girls Club down in Chester. Always Best Care, we had a career event down there. Thanks for everybody that came down to participate. We are actively looking for workforce, and we welcome you to check out our website. If you missed the event, you can certainly go to teamgreenabc.com. That's Team Green, green with the E at the end, abc.com for our open positions. We offer full medical, dental, vision, and a competitive 401k. If that is you, I tell everybody out there right now, and I'm not being funny, don't mess around and spend all your STEMI bread and wait till the last minute to go back to the workforce. There are a lot of jobs out there hiring, not just Always Best Care. And so there have been news out there that, people all over in all different types of backgrounds and industries are really, really looking for the workforce. So again, I just want to remind my friends, don't wait till all your STEMI bread is gone before you try to regain the workforce and be the one left holding the bag. Just saying it, just friendly Uncle B advice. Also, want to give a shout out to Derek Phillips, who's the executive director down there, my frat brother, for giving us a chance to come down there. We definitely do support the Boys and Girls Club of Chester down in Chester, Pennsylvania. Shout out to Omega Optical. If you're looking online right now, you see that I am rocking. My producer, my engineer, they're jogging me, talking about I got on old school frames. These are my new glasses that I got from my good friend, frat brother, my chapter brother. He plays now Virginia State too. Steve and Tracy Davis over at Omega Optical hooked me up with 3 pairs of glasses because I was too vain to get the bifocals. I got some distance glasses and some reading and computer glasses, and so that's just what I chose to do. Don't judge me. That was my choice. But shout out to Steve and Tracy and Omega Optical for taking care of me. If you're looking for incredible customer service and, a class act establishment, and they are also a minority-owned business, certainly give Steve and Tracy a play at Omega Optical. You can check them out online. Okay, I am so excited today because on my show today, I have somebody that really caught my attention. I was asked to participate in a panel discussion at the beginning of April with WURD and WURD teamed up with AARP, and so I was invited to my good friend Andrea Lawful Sanders' show, and then she had a co-moderator, Angela Forsaw Rouse, who's with AARP. I think she's like the state community outreach and operations person for them. But anyway, just both women are class acts, and so when they really invited me to this panel discussion, one person stood out for me, with just her information and just her approach to how we're really dealing with, pandemic and working with a health initiative. Ms. Veronica Hill Milbourne. I looked at her background. I stalked her a little bit on online media. She gave me her bio, but I'm going to tell you, she's a nurse. She went to Villanova University. She went to St. Joseph's University, where she got her master's degree in health education. She graduated from Temple University. She's also a lawyer. So not only is she a nurse, she's also a lawyer. And, I got to tell that to my young people out here that really are aspiring to be something or somebody. And she just speaks in just such easy to understand language. She is the president and CEO of Spectrum Health Services. Spectrum is federally qualified health center with 3 locations and serving Philadelphians for over 55 years. Ms. Hill Milbourne is a registered nurse executive and has spent over 30 years devoted to creating home and community-based programs to meet the needs of the greatest needs of the folks and individuals. She's a person that has class, and she said some things during our panel discussion that I just had to ask her, and I know she's busy, and I'm just so glad and appreciative that she was able to come on my show. Without further ado, please welcome to my show, Veronica Hill Milbourne. Veronica, you there?
I am, and wow, what an introduction. I feel so honored. Thank you.
You really don't know, and I said it in that panel, you really don't know when you're speaking to somebody's spirit. And, I'm pretty sure that we as administrators, owners, administrator, president, and just, executive leadership, we probably see a lot of the challenges, especially in the current climate. And just hearing somebody talk about it from just an altruistic approach, a pragmatic kind of operational approach, it gave me uplift. And I just really wish you could have talked more. And that's why I invited you to my show, because I'm gonna lay it on you, and I hope you lay it on the folks. First of all, happy Mother's Day if you're a mom. Happy Mother's Day.
I am a mother. Thank you so much.
And I don't know what your plans are for tomorrow, but I hope you have a really restful day, because I know you're really busy every other day, probably tomorrow too.
Well, actually, I'm so happy because I have 2 daughters, and my oldest daughter surprised me and came home from New York this afternoon, so I will have both my chickens in the nest and I'm absolutely over the moon.
Well, right on, right on. So tell us, where is Spectrum located?
So we do have 3 health centers in Philadelphia. We have a health center at 5201 Haverford Avenue in West Philadelphia. Also in North Philadelphia, 1415 North Broad Street. And in South Philadelphia, 1325 33rd Street.
And so, go ahead.
Yeah, and I think what's wonderful about our community health centers is that our providers, our physicians, our nurse practitioners, our social workers, our care managers, our behavioral health consultants, they come from the communities that we serve. So they specifically understand the needs of those at highest risk for chronic conditions. And they have what I believe is customer patient care in their DNA.
And they don't healthcare shame you.
No.
It's a lot of that going on these days. And so these services, tell us about the services. You've named some of the practitioners that are there, but can you go through the hours of operation, what insurances or community programs you're connected to, and what services do you offer?
Right. So let me start with our services. We have a full suite of services. We provide adult and pediatric primary care, dental, behavioral health, and you know behavioral health right now is so very, very important, podiatry, OBGYN, HIV, AIDS, and Hep C treatment and management support. We have our own in-house pharmacy, and patients that are served by Spectrum can benefit from our 340B discount pharmacy program. That's really important. When people are dealing with very limited resources, they need to be able to get access to their medications, and by using our pharmacies, they can get their medications at a fraction of the cost. We also are offering COVID testing and COVID vaccination. In addition, yes, I'm sorry.
No. Before you go on, I just want to ask you, what are the hours of operation? I know you. Don't forget that piece. But go ahead.
Yeah, we are open from 8:30 to 5, Monday through Friday at our Haverford Health Center. At our Reed Street Health Center, we're open Monday, Wednesday, and Friday. And at Broad Street, Tuesday and Thursday. Telehealth is provided every day of the week, Monday through Saturdays. And patients can reach us to schedule an appointment. They can go online and use our patient portal. Our website is www.spectrumhs.org. They could also call us at 215-471-1267.
And anyway, and so you offer all of these care. What kind of insurances do you offer and that kind of thing? Because you mentioned that and I threw you off track. You were about to say something about the prescription program, and I interrupted, and I apologize. But what insurances do you accept, and how do you work with the individuals in the community?
Right. We accept most all insurances. And what's unique about being a federally qualified health center is we don't turn anyone away. We will develop a payment program based on income and family size. So it's an affordable way to get your health care needs met and to receive quality health care that will take care of all of the needs of your family. We are a federally qualified health center. We are also a patient-centered medical home. And what that means is that we've been certified by the National Commission on Quality Assurance that we are considered a quality provider with the highest deemed certification in the country.
Oh, wow. I didn't know that. And so, okay, so then you have that going on. Tell us about your role. What is your role, and what are some of your goals?
Well, my role as the Chief Executive Officer and President of Spectrum Health Services is to make sure that we are meeting the needs of our community and providing quality health care. My goal for Spectrum is for us to be able to provide a world-class experience for everyone that walks into our health centers. Our health centers are absolutely beautiful, and I invite people to come and take a look. We have, as I mentioned before, an array of services. You will be received with the utmost respect and kindness. We strive to meet the needs of all of our patients, and we know that people are going through a lot of challenges right now. And so we want to meet people where they are. We're also involved in a number of community outreach efforts. We have a program called Spectrum Without Walls. So we really want to meet our patients, people in the community, where they need their services most. So we will partner with churches, schools, senior centers. Wherever there's a need, we've been providing, as I mentioned earlier, COVID vaccination and COVID testing. So if there's a need, just give us a call.
So, all right. So if you just tuned in, my name is Brian Green. I'm the host of the Did You Know Show. And on the phone with me right now is Veronica Hill Milbourne. She is the president and CEO of Spectrum Health Services. They have 3 locations. They offer a wide range of services. But right now, let's, if we can, in addition to the services, I want to ask one question about nutrition. You didn't mention nutrition, and I have a special interest in that. What is involved in that program?
I apologize, but we do have a registered dietitian, and she's absolutely fabulous. We have the nutrition support, weight management. Prior to the COVID pandemic, we were offering cooking classes, and we had an education program around plant-based nutrition. And that's so important, especially for those patients who are struggling with diabetes and hypertension. Our physicians, we have another physician who is a certified specialist in obesity, and it's one of her passions to help patients with weight management.
I'm sorry. Go ahead. I don't know if that's us. I don't know if that's us or you. Are you still there with me, Veronica? Are you still with me? She might have to call back in. Oh wow! Just when we started to get good, we had a little technical difficulty. So let's Mike, if you're listening, go ahead and I want to dedicate our mid-show song while we reconnect with Veronica, because this is information that we need. And anyway, I want to dedicate my today's song to my mother, who led by example. She continues to lead by example. As a child, me and a couple of my friends were talking about our childhood, and I just remember, my mother always working 1.5 jobs. It just seemed normal. She always had 2 jobs. I just, and I had in a lot of ways emulated that for a very long time. Now I have the business, but very hard working, do it her way, and she's gonna pay the price to do it her way too. So I think I picked up that lesson really good. But I want to dedicate this first song to my mother. Mom, if you're listening, Mom listens to the show. She always gives me good feedback and that kind of a thing. If you listen to the show, this is dedicated to you. And it's dedicated to all the mothers that are out there that really, really are wildflowers in their own way, and really, pay the cost to be the boss, the queen of the castle. And I want to also, send it out to those folks that are missing their mothers and grandmothers, and those folks that are this time. So, if Mike, if you're listening, go ahead and play "Wildflower" by New Birth.
She's faced the hardest time you could imagine. Many times her eyes fall back the tears, Lord, Lord. And when her youthful world was morning. Each time I slim the shoulders of the weight of all the fears, and a sigh when no one hears, still raising my silence in her ear. Let her cry. Gentle flower, grow wild. And if by chance I should hold her, let me hold her for all time. And if I allow just one possession, I would pick her from the garden to be mine. Careful how you touch her, she will awaken. Sleep the only freedom, all that she knows. Love, love. When you walk into her eyes, you won't believe the way she's always paying for a debt she never owed. The silence still blood, but only she can hear, so she goes. Let her cry, for she's a lady. Let her dream, oh, she is my child. The flower grow wild. She is my flower grow wild, yeah. Oh, she's my flower, she grow wild, yeah. Sit down, baby, and let me rap to you for a second. You see, I know you have it hard sometimes, but when you feel like you need me, or you can call me. You see, because I'll be somewhere around. You see, not only that, you see, I'll be your bridge over troubled waters. You see, the reason why I say this, baby, is because I love you, girl. I love you so much. Oh, sometimes I can't even explain. You see, you're like a flower that blooms in any season. And that's why I like to say, you're my flower, baby. You're my flower. Oh, baby, a flower. You're my flower. Flower. It's you, baby. It's you. It's you, baby, baby. It's you, baby. It's you. It's you, baby. Yeah, 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 yeah. I love
Welcome back to the Did You Know Show. That was Wildflower by New Birth. I dedicated that to my mother and all of the mothers out on Mother's Day. That just some hard-working mothers that really led by example. You guys, mothers, black mothers, and I'm talking, to you just for a minute. Y'all pray differently. You have to. It's hard raising, in this climate where, some folks really do want to set the clock back. And, not for nothing, we really, really, really hang our head and on your shoulders, and we really, really, just appreciate the backbone. I think when I think about that song again, I just think about, again, my mother just having, for most of my childhood and into my adulthood until she retired, having 2 or 3 jobs. I just thought it was normal. And a lot of my peer group, their mothers worked the same way. Just always having a side hustle, just seemed like to be the norm. So, when I hear young people make excuses these days, I got to let them know, listen, we didn't have a whole lot either, but we didn't make any excuses. We just went ahead and put a, and sometimes you just got to go hit it. Whether that's getting on SEPTA or getting up early, to go to work. You got to go to work. Everybody has to work. It's the American way. So anyway, that was my dedication to the Mother's Day. Everybody have a happy Mother's Day. Want to rejoin the conversation. We had some technical difficulties, but I think Veronica's back. Veronica, you back?
I am back. Can you hear me?
I can hear you, and thank you for coming back. Again, I appreciate you coming on to the show. I know you're very busy, and for those that are just joining the show, Veronica Hill Milbourne is the president and CEO of Spectrum Health Services. They have 3 locations, and we were in the middle of, you were finishing up the thought about the nutritional services and the obesity clinic and cooking classes and that kind of thing. And then I want you to finish that thought because I have another question.
So I think that we have a physician who is a certified obesity provider, and she is very passionate about helping patients to have weight loss and to achieve their personal health goals. Our nutritionist is excellent. She works individually with patients to help them with healthy lifestyle changes, dietary choices. Our team is just phenomenal. Sometimes we find that obesity is related to behavioral health challenges. And so we have a number of behavioral health counselors that can help people to develop lifelong changes in their health care and their behaviors.
So you said it softly, but I want to focus kind of a good part of our conversation. You guys your team is doing COVID testing and vaccinations, correct?
That is correct.
How does one go about finding information, or what is that? What is the COVID test experience, and what is the vaccination? What does it take to get vaccinated? Do you have to be a Pennsylvania resident? That's some of the questions I get. Do you have to be a Pennsylvania resident? Do you need to register? Do you have to have insurance?
Well, you don't have to have insurance, and it's very easy. You just simply can call. We have a dedicated line for patients to call to register to get the vaccine, and that number is 267-670-7822, or they can simply go online to our website, and I'll give you that website address again, which is www.spectrumhs.org. In the right-hand corner is a tab. Click on the tab, put in your information, and someone will call you back within 48, 72 hours.
And so, one of the things that caught my attention when we were invited, we were a panel discussion on Andrea Lawful Sanders' show. One of the questions that caught my attention, well, your answer caught my attention. Now, I'm not going to spoil the presentation, but we talked about what are you hearing in the community specifically about the hesitancy of people getting the vaccination, and you had a really poignant answer, and I just want you to really speak to that, please.
Well, this vaccine, the science behind the vaccine is not new. It is safe. I've personally been vaccinated. I was the first person to be vaccinated at Spectrum because I did my research and I trust the science. And this is the only available tool that we have to really combat the spread of this virus, which we know is deadly. I've known individuals in my family and friends who have lost their lives to COVID-19. I am so happy that we now have another tool in our toolbox to fight this virus. I know that communities of color, people of color, are hesitant because of history of experimentation, but that's not the case here. And so when I talk with my Black and brown sisters about their concerns in terms of getting the vaccine, I remind them that when the vaccine was rolled out, it started with rolling out to our healthcare providers. If there was a conspiracy to take people out, why on earth would you start with your healthcare providers? You need those folks to take care of you, right? So you wouldn't want to take them out. Secondly, I tell folks that when the vaccine was limited, it wasn't our Black and brown sisters that were scrambling to get the vaccine. It was many of, our other sisters and brothers. So what is it that they know that you don't know? So the vaccine is safe. And in order for us to get in front of this pandemic, we all have to be vaccinated. Now, there are some common side effects, and we've all heard about, some of the experiences that people have. I had it myself, a sore arm for about 48 hours. Some people have reported chills. It's the same thing that you would experience if you got the flu. But the vaccine is designed to help your body to develop the normal antibodies that you will need when you come in contact with the virus. This is the same science and technology that was utilized to create the measles, mumps, rubella vaccine that we give our children. It's completely safe.
And so, as I'm sitting here listening to you, right now, well, first I want to remind my listening audience that Veronica Hill Milbourne is not only an RN, she's also a lawyer. And I think, and I read in your bio that you're also an adjunct professor at Immaculata. Is that still going on, or are you teaching virtually?
Well, I did teach virtually. I don't have time to teach right now because I am immersed in the work of Spectrum Health Services.
Okay. So I wanted to say that because I have so many people right now that I talk to in my peer group that, are either in some type of leadership role or, like myself, a business role, and we're having to make decisions, for folks, while a lot of folks have gotten vaccinated, myself included. I had the Moderna, and I had the symptoms just like you did. I had a sore arm, but I also experienced some fatigue, but nothing out of the ordinary. And Veronica, I'll tell you, in the beginning, I was not trying to jump in line. I was really nervous too. I had boiled myself up in the lab and thinking, oh, I'm gonna get an extra ear, or my nose is gonna fall off. All these type of things, because of fear, and just that kind of thing. But when you talk to people and you really sit down and you do your research and you tap into your intellectual curiosity, there's a lot to that. But a lot of business leaders have had to kind of make the decision because now, EEOC and both OSHA have come out and said that, it's pretty much up to the employer to really indoctrinate policies to make their workplace safe. So that means while they're not telling you that you can or have to get a vaccination, if you get sick, it's up to the employer whether or not you're now having a lot of employers, myself included, now giving you a deadline and say, okay, if you don't want to get the vaccination, if you get sick, that's on you. Whereas before we had some workarounds where, we were offering people to work from home, depending on what your role was. And then also we had to compensate you. So now, from a business perspective, it's kind of like you can't have it both ways. A lot of people are still saying, well, I'm scared. I think it's going to trigger this and it's going to trigger that. What approach have you done to encourage people, Veronica, to take the vaccine? Like, you just made perfect sense to me. But from a leadership role, if you don't mind sharing, I don't think you guys at Spectrum Health are giving people $100 to take the vaccination.
No, absolutely not. No, But most, I would say, the lion's share of our workforce have taken advantage of the vaccine. And I think it's so important for leaders like myself to get out front and show people that it's safe by, showing that they indeed have taken advantage of the vaccine. Our chief medical officer, Dr. Kila Muhammad, was the second person at our health center to get vaccinated. And I think that was so important for our staff members to see, look, the top 2 leaders of the organization have gotten vaccinated. My entire executive team has been vaccinated. So I think just role modeling and providing as much education, having adult conversation with people about their fears. When I have an opportunity to talk with people about their hesitancy, within 5 minutes, and probably less, they're convinced, okay, I'm going to go ahead and I'm going to take the plunge and I'm going to do it. Now I recognize that some people have religious beliefs that, preclude them from getting the vaccine, and I respect that. So at Spectrum, we've not made it mandatory, but I've not had to make it mandatory because our people are seeing the devastating effects of COVID each and every day on patients. I mean, some of the symptoms or the damage that occurs with many people who have contracted COVID is irreversible. Lung damage to the tissue, where the elasticity of the lung is damaged, and you don't get that back. And so I tell people, why take that chance? Protect yourself. You have a resource, a tool that can protect you. Don't delay.
And so while social distancing and wearing masks and not being able to gather with friends and family are burdens that have been carried by many people since the start of the pandemic, can't believe there's more than a year, but this, since 2020, when do you think we will return to normal levels of connection with our friends and family? And I know President Biden's goal is to have at least 70% of people vaccinated by July the 1st. And I was really hoping and praying, selfishly, that Pennsylvania would lift some restrictions so maybe we could have a Dell series, but that's my own private situation. But do you know of anything? What do you think? With the goal of it, do you think that we'll be in a position to return to normal levels by the end of the year from what you're seeing? I mean,
I don't have a crystal ball. I'm a little concerned because we've seen a number of people. The demand is not what it was for the vaccine back in February and in March. We're starting to see some numbers dwindle. So that's a little concerning. In order to get back to some degree of normalcy, it's going to require that the majority of folks take advantage of the vaccine. Now, the CDC does recommend that you can gather if you're gathering with people who are fully vaccinated. And as such, the people that I associate with now are fully vaccinated because I miss not being able to be with my family and my friends. So my family and friends are vaccinated so we can get together, we can eat, we can hug each other again, and that's so important. And that's what people need to recognize. In order to get back to some degree of normalcy, we have to get vaccinated.
So, there's another problem that's going on too, Veronica. I don't know which vaccine. I don't know which vaccine Spectrum Health is given, but I took the Moderna. But we have reports that we've been getting, and I'm sure they come across your desk too, that a lot of people are not returning to get the second dose. What do you think?
So I think that the issues that came out regarding the Johnson & Johnson vaccine did put some concern and hesitancy in some people's minds. But the Johnson & Johnson vaccine is also safe. There were some rare cases of people who had some blood clots, but again, there has been countless investigations and review about the Johnson & Johnson vaccine. I don't believe that it's a problem. At Spectrum, we are giving out the Moderna vaccine, and we chose Moderna because its stability is not as reliant on temperature control, and so it's just easier to manage for us. And we did not have the sub-zero refrigeration required for the Pfizer vaccine. But the vaccines that are out on the market are safe.
There have been reports about mutations of the virus now in the United States. What do we know about how well the vaccines work against these mutations? Have you heard anything?
So I believe, based on my research, that the Moderna and the Pfizer, I can't speak to the Johnson & Johnson vaccine. I just don't know enough about the recent studies about that. But that the vaccines are equipped to handle some variants, not all. I know that in my research that there will likely be a need for people to get a third booster if they've had the Pfizer and Moderna. And if you just think about, the flu vaccine and influenza, we have to get that every year. There's different strains of the flu and influenza vaccine that come out, and we have to get, our immunities and our antibodies to respond to those specific viruses. So this is not unusual. This is not uncommon. I feel very blessed to have the availability of a vaccine that can keep us protected.
So if you just tuned in, my name is Bryant Green, and I am the host of the Did You Know Show. I want to remind the listeners that you can catch us on TV on Comcast and Verizon, Channel 4 and Channel 798 at 7 a.m. The Did You Know Show is centered around connecting people to home, community, and business resources that you may or may not have known about that are right there in the community for you to kind of just take access to. Today, my guest, Superwoman, and I really was impressed, and I'm really so appreciative that she took the time to come on my show because I know her dance card fills up really quickly. I have Veronica Hill Milburn, who is the president and CEO of Spectrum Health Services, and she has, she's a registered nurse and a lawyer, and I right there, I'm kind of thinking to myself, I want to ask so many questions about that, but I don't want to cross the lines. I want you to come back. But what, if you don't mind, what was the goal? I always have young people listening. What was once you became a nurse and then you went back to law school? Can we go there for just a little bit?
Sure. So I grew up in West Philadelphia, and I saw my family members. I saw people struggling to get access to care, and I always wanted to become a nurse. And so after going to nursing school and becoming a registered nurse and working in a local community hospital, my first role was a nurse in an oncology unit at Misericordia Hospital in Southwest Philadelphia. But I saw that there were issues with our patients receiving quality care. And so I wanted to be a game changer. And I thought, well, the only way to do that is to go back to school and get a degree in health education, and I will teach patients how to advocate for themselves, how to, make healthy choices. And that helped somewhat, but it really didn't make a major difference. And so I decided, well, I'm going to have to attack this on a higher level, public policy, compliance, rules and regulations to make sure that people have access to care. And that's what drove me to law school.
Wow. And so so what are the upcoming events at Spectrum? I know you guys partner sometimes in the community. I don't know if you have any. I know it's really hard probably to have anything other than virtual events these days and times. But do you have any routine events like with your nutrition? And I'm asking selfishly for me because I'm type 2 diabetic. And that's the one thing after my recovery. I was sick for a little bit early this year. The one thing that I haven't nailed down yet is finding me a nutritionist. And I've tried, but I'm thinking about I'm going to try and give Spectrum Health a play. But, do you have routine course of events that happen at Spectrum Health? In other words, Go ahead.
Yeah, we have routine events all the time. We just finished last weekend. We partnered with Senator Vincent Hughes on the May Day Challenge, and we had a number of our elected officials at our Haverford Health Center. We had a DJ out in the community, and our goal was to vaccinate as many people as possible. We had scheduled patients and walk-ins. We have just now opened our new pediatric wing at Haverford, at the Haverford Health Center, because we really want to provide more services and access to our children. And so I would just tell people to continue to monitor our website for announcements about new programs and services. But, Brian, you don't need to wait. All you need to do is call, and we'll get you right in.
Listen, Monday, I'm all over it. I am all over it because, I had a real experience, Veronica, and I don't want to get too long in the tongue about it, but because of my uncontrolled diabetes earlier this year, I had, multiple surgeries, and I recovered, and, recovering, that kind of thing. I'm trying to fly right. I had to completely take out that cranberry ginger ale soda. That was my nemesis.
Yeah,
but my sugars are in line, but I'm just trying to, I'm not bragging, I'm a pretty awesome cook, but food has become in a lot of ways also, something I have to really, really pay attention to. So I'm taking my medicines, kind of, the life of a type 2 diabetic, the confessions of a type 2 diabetic, if I'm being honest. I'm like, I got to lay on your couch now and give you my insurance card and tell you my therapist. But I need to sign up for a nutrition. That's the last piece of this puzzle. And I went to a major health system, won't call them out, but I got spent around in a voice response system, as I'm sure a lot of people did. Now, what I was going to make the point was, going through this, I think I'm pretty good at, facilitating, providing patient and home care in the community, but being a patient, not so much. And anyway, going through that experience of being a patient was very overwhelming. With managing the doctor's appointments alone can be really overwhelming if somebody doesn't have, an advocate. Do you guys at Spectrum offer advocacy, like an ombudsman program or something like that for those folks that are?
Absolutely. We call them case managers. And so they will help patients navigate the complexity of the healthcare system. They're absolutely wonderful. They have resources in the community. They can walk you through the process, help you schedule appointments. We also have a community health worker who is what I refer to as our boots on the ground. She can go out with patients to appointments if necessary. And here's another wonderful resource that, out of the pandemic, as horrible as, the impacts of COVID have been, one of the great things is the acceptance of telehealth. So you don't have to worry about coming into a health center if you're afraid or concerned about coming into contact with people. You can access your physician, your nurse practitioner, your social worker, your case manager, your nutritionist. We offer all of those services via telehealth. And what I've seen is now patients who were forced to make a choice between coming in to see the doctor or the nurse practitioner or healthcare provider and paying a copay. Let's think about a single mom who has several children and she's got a $25 copay, and she's got to decide, do I spend the $25 to see the doctor to take care of myself, or do I put food on the table? Well, most insurance companies have waived the copay for telehealth. So now there's no reason why you can't have access to your healthcare provider. We make it easy in the privacy of your own home.
So I'm getting the flag, and unfortunately that's what happens. You have a guest with so much information. Veronica Hill Milbourne, thank you so very much for coming on to my show. I'm not done with you. I hold on to people. I won't stalk you, but I'm definitely going to try to stay in touch with you and follow up with you. And I really appreciate taking the time, because I know you're really busy. And again, happy Mother's Day. One last time, can you just give us the phone number to the Spectrum Health, please?
Sure. 215-471-2761.
Okay. All right. That's my show. That's what I'm sticking to. I'm going to dedicate this last song to all the mothers out there, to my mom, to my grandmother, Sadie by the Spinners. All right, everybody, peace and light. This has been brought to you by Always Best Care. We're the agency that never sleeps. You can call us at 267-909-9248 or visit Team Green ABC. Thanks, and I'll talk to you next week.
In a world like today, it's a rare occasion to be able to see young